Okay, I'm going to sneak in one more, just to sneak one more. And so maybe if you guys could give slightly briefer answers, just so you could each answer and tell us what the research says. But I'd like to ask this one more. Mother Nature Network. Asthma rates at highest level ever, says CDC. 25.7 million people had asthma in 2010, including 7 million who were younger than 18. Asthma rates in the United States increased over the past decade to their highest level ever, according to a new government report. The portion of people in the U.S. with asthma rose from 7.3% in 2001 to 8.4% in 2010, according to the report from the Centers for Disease Control and Prevention. This means 25.7 million people had asthma in 2010, including 7 million who were younger than 18. If you guys would each give your thoughts on what the research shows.
I'll just start. I'm not going to start. I'd like you to start again. I read a lot of meta-studies because I spend a lot of time outside of the United States. So we seem to be very Americana in our research and statistics and data here. I want the listeners worldwide now, today, and in the future to realize that it's reflective of what you see in all of the developed world. So the same statistics you'd see in Germany or in France or in Italy or Spain, it's very similar. So don't think, oh, this is an American conference and they have the problem. Unfortunately, we share that problem with you. You all learned English.
We're great at exporting our culture and our diseases. Asthma and allergy and eczema, something that we see a lot in children. Part of this is being now traced back to the bacterial flora that the immune system sees in the first hours and days and weeks and months of life. Children are not born sterile like we thought they were. There's actually bacteria that live in the umbilical cord, and there's bacteria everywhere that are actually good bacteria, belong there, and are helpful and are actually using some of their DNA is being used by the body to run certain body functions. So what a woman eats has to do with what the genetic settings are in the chromosomes of the child. We'll talk about that tomorrow afternoon. Whether or not the child is a cesarean section or a natural birth sets different bacterial settings in the infant's body. Whether or not that child is breastfed versus bottle-fed completely changes the predominant bacteria that's in the GI tract. And by the way, a C-section child that's bottle-fed does not have the dominant lactobacillus and bifidobacter that are needed to convert fiber into butyrate to get a gut to be a semi-permeable membrane and recycle water and not waste. And the immune system gets intolerant and overreactive rather than tolerant and underreactive when the child starts out with a set of bacteria that are not natural. And so they enter life then with the immune system being a hyper. And so whether the skin is overreactive or whether the airways are overreactive as an asthma, or whether the GI tract is overreactive to certain foods or become sort of allergic to them, that's turning out to be highly related to the good bacteria that are present or not present in the child's GI tract. So that's something that we'll all be watching closely.
This is a lecture that we won't want to miss. It sounds fascinating. It's amazing how much we're learning about healthy microbiome and even affecting brain function. Who would have known? But very, very important subject. I won't say much about this topic except that I've recently seen some reasonable research on the connection between dairy intake and asthma. And also, I think we really need to think about all of these pollutants, these chemical contaminants that move up the food chain that are poisoning us. And I think those are two things that we also need to consider where asthma is concerned.
I'm on. Let me just add a couple of things, and especially that, I've been in the trenches treating people with these conditions for many, many years, and it's very important and exciting to watch people get well and recover from asthma. And I've had, lots of patients make complete recoveries, especially people who had to wake in the middle of the night to use inhalers and who have no life, who couldn't exercise. So really, it's a very troubling disease for a lot of people. So to add two things. One is we know that asthma is reduced in populations that live on dirt floors, for example, and are exposed more to more dirt. Even having dogs to bring dirt into the house lowers the risk of asthma in children and in allergies because you're exposed to more bacterial challenges. And also the use of, that doctors treat young children with antibiotics, young in life, when they're young. Usually it's for an ear infection that's predominantly viral. The first ear infection is usually viral, and the doctor then gives them an antibiotic for a viral infection. The child could have recovered without an antibiotic, but the use of the antibiotic when they're young predisposed them to more frequent and more serious bacterial ear infections, which they wouldn't have had they not been treating the first one with an antibiotic, which then kills out a lot of the good bacteria and predisposes you to more serious organisms that are more pathogenic. But there's a link between those antibiotics used early below the first year of life or used early in life and a higher risk of asthma because it changes the gut flora and other problems like that. And there's a link between the overuse of antibiotics and the continual use of antibiotics and breast cancer, for example. Women who use antibiotics frequently or have a higher rate of breast cancer. So we're talking about the medical profession does contribute to asthma to a degree by the overuse of drugs, which is another way we get more toxins and petrochemicals into our body that can cause more excitatory and pro-inflammatory and irritability of tissues. And, let me just say that the inflammatory response is closely intertwined with the process of repair. In other words, in the book Robinson-Cochran that all medical students learn, or used to at least, in the first year of medical school, the pathology book we learned, and right in that book it said the inflammatory response is closely intertwined with the process of repair, and inflammation serves to wall off and remove and attempt to reconstitute the damaged tissue and as much as possible restore the tissue to its pristine state. In other words, the inflammatory response has a right direction to it.
Yeah, exactly. Repeat that. So
Yeah.
there's inflammation's a necessity to heal.
To heal, right. So sometimes when you have an asthmatic who you're using beta agonists, which could be life-saving to allow the person to breathe, but it also can cause more chronic irritation and make the person more predisposed to asthma. And when you use oral steroids and they use inhaled steroids, they could be making the person feel better, but you're essentially preventing some of the inflammatory substance from being removed from the body because the attack itself or the inflammation itself is something that could be dangerous, but is still the body trying to remove toxins and remove waste products from its tissue. So what I'm saying is, with good nutrition, with allowing other channels of elimination and detoxification to be mobilized, with weaning off the oral medication and getting onto getting off the beta agonists, I find with time that the person can get by with just an inhaled steroid used with a spacer, and then we can reduce the dose gradually, and we're able to gradually taper this person down to less use of medication. And then sometimes, on occasion, I've used therapeutic fasting, where I have the person, because the person really still needs some medication, and to take it away may exacerbate an attack. So I take it away under the auspices during a time when they're not eating food, because there's a very powerful natural anti-inflammatory effects of fasting, and that can enable them to stay off the inhalers for a period of time to allow the detox to resolve without creating a problem where they need to take medications for it. It can, so they're breathing better, and then that can help them get to a point where they can get free of their asthma totally. So I've taken care of hundreds of cases with asthma with excellent success, sometimes necessitating to use fasting, but most of the time just slowly over the years seeing asthma and allergies get better and slowly weaning off medications, and sometimes it takes 6 months, 12 months, or 24 months to see these improve themselves sufficiently. And you've probably seen similar.
No question. I'll try to be concise and succinct. Pollutants are the number one cause. This is skyrocketing. And let's name a few, because it's not just the air pollution the water pollution, the pollutants on your food, but your clothing, it outgasses 24 hours a day, 7 days a week. Your bedding, I was just told 3 days ago now, 5 years ago, they've demanded you put 2.5 times more fire retardants on it. All infant clothing, 8 out of 10 infant products, high chairs, car seats, all have fire retardants on them. If you look at inner cities here in the United States, there's 100% of the children in these inner city schools that have asthma, mold, yeast, fungus, bacteria, and certainly on a horribly bad diet. These are deserts for food. These people eat nothing but junk food. They can't even buy anything but junk food. And many of these people don't have an income to even get in the car and go somewhere else and buy the food. There's, as you saw the other day in Nelson Campbell's wonderful documentary, they're going into a lot of these underprivileged areas here in this country and bringing in fresh fruits and vegetables, and congratulations to them for that. So this is a plague. There's so many plagues. I mean, as I said to you the other day, if you're depressed or neurotic, you shouldn't be listening. Because we have resolution for all of this, by the way. You know, matter of fact, next year's conference will be 35 days on resolutions. Right, Steve? Let's talk about the remarkable thing that you discussed. If a mother is breastfeeding, now, we used to take that for granted, but it doesn't happen in the majority of cases. Within a matter of minutes after the baby comes out of her womb and they suckle on her breast, Lactobacillus bifidus comes out. Do you realize if you live 200 years, that's enough bacteria to have your immune system function at 100% level? And MIT did a study on that back in the late 60s where they showed one soda throw that into an imbalance. Several, obviously. I used to drink 5 or 6 a day, probably wipe it out. 70% of your immune system comes from the bacteria in your intestinal tract. This is not a small thing. It's a very big thing. And now today in psychiatric medicine, as you heard over the last few days, we recognize that the gut factor is probably the most important factor. Serotonin is produced in that area, not in the brain as they're teaching in neuron science at universities today, but almost overwhelmingly inside the intestinal tract, the stomach, etc. So if you don't have that going on, and you don't have good chemistry and good hormonal balance, hormones are the messengers in the body. They're the language of the body. And the lungs actually stop learning how to work, especially if they have pollutants going into them 24 hours a day, 7 days a week.
I want to thank the 4 of you very much for taking your time to come here and share all this information with us.